In this final chapter, we will examine how the Medical Priority Dispatch System, or MPDS, was deployed and is being used specifically in Snohomish County. Here in Snohomish County, the MPDS is governed by a committee that includes broad participation from a variety of roles within the EMS delivery system. The Dispatch Review Committee and Dispatch Steering Committee are made up of Snohomish County 911 leadership, the Snohomish County Medical Director, as well as field personnel from various fire departments, including EMTs, paramedics, and MSOs. Together with quality improvement experts, all these entities provide continuous feedback for improved delivery of service. While the MPDS is a very structured system, the configuration of how units respond is driven by local decision makers. Examples include whether units respond with lights and sirens, response mode, or whether ALS or BLS units are assigned, response type. Such decisions are made by local entities that include the EMS Medical Director, agency paramedics, and EMS providers. The ProQA determinant code is based on the severity from the medical triage made through the system and ultimately drives the assignment of dispatch type code. This connection is based upon analysis of the type of treatments and interventions being performed by first responders. The greater the severity of determinant code means the call will be assigned a higher priority type code. The determinant code is also found throughout the incident record. This determinant code enables the review and steering committees to aggregate cases with the same symptom for further analysis. Note that the protocols have more than 1,500 individual determinant codes, and each code is assigned a locally chosen response level. As mentioned earlier, the two groups that configure the system for Snohomish County are the Dispatch Review Committee and the Dispatch Steering Committee. They routinely meet to review system configuration and consider adjustments to protocol response levels. All the agencies represented on these committees have their own unique protocols depending on their mission. For example, Snohomish County 911 follows protocols for the dispatch center. EMTs and paramedics follow protocols and processes in the field. Hospitals follow checklists and processes built for care at their facilities. However, the review and steering committees are looking at the big picture. Their aim is to evaluate EMS care from the initial 911 call to EMS impressions and eventually hospital outcomes. This is considered the gold standard for EMS care. With this level of evaluation, we're in a position to make data-driven, intelligent, system-wide decisions based on development of trends and how the community and individual agencies respond to EMS in the county. This means that each change is made through the governance committees and supported by data from CAD, EMS, and hospital systems. Emergency medical dispatchers work in a challenging, non-visual environment, making rapid decisions in an effort to initiate the EMS response. They must assess scene safety for first responders and provide instructions that prepare the scene and provide a wide range of care until responders arrive. Changes can occur while responders are en route and can be upgraded or downgraded as the situation develops. What a non-medically trained layperson reports to 911 doesn't always match what paramedics or EMTs find when they arrive on the scene. For example, when the system sends advanced life support, it's not necessarily because ALS care is needed. The protocol is not performing a clinical diagnosis. Rather, this is based upon reported symptoms where an ALS assessment is justified. We understand that if a patient is complaining of chest pain, A paramedic skill set applied on-site is required to rule out a cardiac event. That same philosophy is built into the protocol. Just as reviews are conducted on areas of care to ensure consistency with EMS protocols, there is a quality assurance and quality improvement component to the MPDS system. This includes the field feedback form, where input is sought from first responders. There's also a specified process for first responders to inquire about how a call was coded or provide additional information. Taken as a whole, this analysis allows the committee to confidently make system changes that can subsequently be monitored, measured, and further refined. In addition to more traditional EMS protocols, the MPDS system has been instrumental in the county's response to the COVID-19 pandemic. The first known patient with COVID-19 in the U.S. was identified in Snohomish County, and within 24 hours, Snohomish County 911 had activated the early infectious disease surveillance component of Protocol 36. This protocol was developed from the experiences of other communities that had already dealt with localized outbreaks of other diseases, such as Ebola and SARS. The protocols are an important tool to help manage finite EMS resources during normal times and during a pandemic. In addition to the work done by the Dispatch Review and Dispatch Steering Committees, Snohomish County 911 has taken other steps to improve service delivery. For example, our rapid dispatch procedure allows agencies to begin the turnout process while calls continue to be triaged and final determinants are established. These and other refinements are done in close cooperation with our more than 20 fire and EMS partners, all focused on improving quality for all our agencies and the communities we serve.